Have seen this report yet?
Dr. Hoskins, you are here in Sault Ste. Marie today to announced some key recommendations, and it appears that Algoma Public Health will be, as you put it, going through a fresh start soon.
Well, I think that's true, and a fresh start is important. The Public Health Unit has many individuals working extremely hard on behalf of the community. So as a result of the assessor's report, which I've received and have now commented on, the report by Graham Scott, he has indicated a number of recommendations, and we intend to implement those recommendations. I think that perhaps the one which for today might be the most important is that I have sent a letter to the chair of the Board of Health asking that all those members of the board who were appointed prior to the last municipal elections in the fall of 2014, that they voluntarily resign.
What do you feel, or have you received any reaction from that request yet?
Not as yet. I understand there's a board meeting scheduled for tomorrow, so that will give the board members a chance to respond to my request.
So you mentioned that there will be audits to follow. How frequent will they be, and what are your expectations from this point on?
Well, I think that in addition to audits, I indicated today that we're going to be providing significant support to both the board and the Public Health Unit. On the Public Health Unit side, to work with them to find and appoint a new medical officer of health, which is critically important to effectively serving the members of this community. On the side of the Board of Health as well, we'll be working closely with our municipal partners because it is a joint process, and there are municipal appointees as well as provincial appointees to the Board of Health here in Algoma, and we will be working closely with our municipal partners to ensure that those who are appointed are truly skilled-based, that are able to contribute to the governance and administration of the board, and that they will be fully trained and capable of understanding what their duties are and being able to effectively fulfill those duties.
Could this be described, this situation, as a breach of trust to those who look out to Algoma Public Health as a trustworthy agency given what has happened?
Well, I think importantly, Graham Scott, the assessor that I appointed and asked to look at the management and administration of the board, and are they fulfilling their duties according to the law and the various acts that apply to them, he determined that they were not, that the level of governance and accountability required to fulfill their duties under the Act was not complied with. Hence his recommendations for asking for the resignation of those who were appointed prior to the last municipal elections. I'm following through on his recommendations, that one, but all of his recommendations.
Can you give us an example of a sort of a similar situation and what the expectations are?
Well, I think...
Would you like to see happen as a result of the changes that...
Well, I think the lessons learned here in Algoma provide us with the opportunity to strengthen the governance, oversight, accountability across the province. It happens to coincide with a review that I've asked. I previously, before this issue came to fore, asked my ministry to look across the province at our public health units to ensure that they are providing maximum support for the population they serve, as well as value for money, and that they're achieving the outcomes that we expect. So I have no doubt that the information that we've obtained as a result of what's happened here in Algoma will prove useful to that process.
How soon will the first audit be, or the first follow-up?
Well, I'm not sure. I'll leave that to the ministry in terms of we have just completed a financial audit, but it will be more than subsequent financial audits. It will be looking at the operations, the governance issues again of the board to ensure that they're complying with the Act.
Sir, can you talk to us specifically about the shortcomings? What did Mr. Scott find that was concerning to you?
Well, I'll let him speak to the specifics, but his finding was that they were not in compliance with their obligations under the Health Promotion and Protection Act, HPPA, Health. I just want to make sure I've got that. I think it is Health Protection and Promotion Act. Let me start again. So Mr. Scott, I'll let Mr. Scott speak to the specifics of what he found, but he determined that the board itself, I asked him to look at the management and administration of the board. I asked him to look to see if they were in compliance with the legislation with regards to governance and accountability. He determined that they were not in compliance, that they were not meeting the expectations that Ontarians, let alone the government, should have of them with regards to management and administration and oversight. And on the issue of governance as well, they were not in compliance with the act that they are required to follow.
And it would have to be, I assume, pretty serious, not just a technical infraction for you to take action as serious as you have today?
Well, I think by my act today to call for the voluntary resignation of the board, all those who were appointed prior to the last municipal election in the fall of 2014, I think you would agree that that is a pretty serious step to take in response to very serious findings. All right.